The term agoraphobia may bring to mind someone who is afraid to step outside their home. In its most severe form, the disorder can be this limiting. But for most people, including children, agoraphobia starts with anxiety triggered by a specific situation. I'm John Wyetzner, a licensed clinical social worker in the Anxiety Disorder Center at the Child Mind Institute. And here are some things to know about agoraphobia in children, including what it is, how it develops, what it can look like, and how it's treated. Agoraphobia is the fear of having anxiety in a place, usually public, that they perceive as unsafe. This can include enclosed spaces like elevators, open spaces like parking lots, public transportation, being in a crowd, or even just waiting in line. People with agoraphobia worry that something bad will happen while they're in these situations, and they'll be unable to escape and with no one to help them. Some children develop agoraphobia after having a panic attack, where their body goes into full panic mode, and they might feel as if they are dying. Fear of having another panic attack causes them to avoid the kind of place or situation in which that happened. For others, agoraphobia can develop out of nowhere, and they may or may not be aware that it's happening. The problem may actually be more noticeable to their parents. Kids don't tend to say things like, "Help me, I don't want to go outside," though their behavior might indicate their fear. Take, for example, a child who begs their parent to take a different route to avoid driving over a bridge. In younger kids, agoraphobia can often look like school refusal or separation anxiety. A child may plead to stay home or return home to be with a parent. But while a child with separation anxiety will be fine if a caretaker agrees to stay with them on a play date or during soccer practice, a child with agoraphobia may still be anxious. For children with a history of panic attacks, it is common to be diagnosed with panic disorder as well as agoraphobia. To treat children with agoraphobia, clinicians use a form of cognitive behavioral therapy called exposure and response prevention, more commonly known as exposure therapy. While it's our instinct to avoid the things that trigger anxiety, exposure therapy is based on the idea that avoiding those things actually makes our anxiety stronger. Facing triggers in a controlled setting makes the anxiety diminish over time. That might mean visiting places a child has been avoiding with a therapist. The more evidence a child has that that place is actually fine, the less strong their association will be with it being unsafe. For kids with more severe agoraphobia, medication may be necessary to help them deal with their anxiety. Antidepressants called SSRIs can help reduce extreme worry and enable them to participate in therapy. While practicing exposure therapy is essential to treatment, clinicians are careful not to push people beyond what they can handle. If a child is afraid to leave their house, the clinician may have to meet with them at home. At first, treatment may just involve a step out on the porch or look out the window. But with the right treatment and practice, a child's world will get bigger. For more information on agoraphobia in children, exposure therapy, and other topics, visit the Family Resource Center at childmind.org.